Direct Connection is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you. Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
Hi, everybody, and thanks for tuning in for Direct Connection. Coming up tonight, what the fight over Obamacare funding could mean for the open enrollment season that is about to get started. But we begin tonight with the accidental cause of death that is right behind car crashes. Joining us for this week's Your Health segment, Kelly Westlake, Assistant Professor at the University of Maryland School of Medicine, Department of Physical Therapy and Rehabilitation Science, and Dr. Jay Menaker, Professor of Surgery at the University of Maryland School of Medicine and Medical Director of the Lung Rescue Unit and Critical Care Resuscitation at the R. Adams Cowley Shock Trauma Center. Doctors, thanks to both of you for being with us.
Thank you for having us.
Glad you were here. The numbers are incredible. At shock trauma, 32% of admissions due to falls.
Yeah, as the population gets older, more and more patients are victims of falls that we're seeing. And, as you said, right now it's the second leading cause of our admissions after motor vehicle collisions.
Is it limited to older folks?
I think there's two different types of falls. There's the younger people or the people that are doing more athletic things, climbing up ladders on roofs, doing things of that nature. But the older people have different types of falls. They're more ground level falls, fall down steps, tripping, things of that nature.
Dr. Westlake, what puts people at risk of these types of injuries?
There's a long list of factors that place people at risk. So one of the things that people often refer to are the fact that people have reduced muscle strength, and that may be a cause. Obviously improving strength might help, but one thing that we're finding is the fact that people have reduced power generation in their muscle. So the ability to contract a muscle fast, because that makes sense. You're going to fall, you have to respond quickly. So that loss of that quick contraction.
So there's a little bit of delay in responding to something, and maybe not the ability to forcefully respond to it.
Right. Not so much strength, but the ability to generate power quickly.
Why is this important? We talked about the raw numbers coming in. You do some of the physical therapy side of it. What happens after somebody is hospitalized with a fall? How big a deal is it?
Well, I think I obviously see the patients when they're first there, but these injuries could be life-threatening. They can be very debilitating. A lot of these people end up with rib fractures, and when you're younger and have rib fractures, it's not such a big deal. But the older population with rib fractures, each rib fracture above 2 rib fractures actually increases people's mortality. And after that, once they get out of the hospital, they have fears of falling and things of that nature. So I think that this is not just the hospitalization. This becomes a long-term effect on these people from these injuries.
Why do people wind up at shock trauma? Everybody thinks of shock trauma as the state-of-the-art emergency room. It's a lot of gunshot victims and car crashes. When do the EMTs decide this person needs to see you?
The state of Maryland has a very unique system that we have a algorithm on which guides them on when to bring patients to us, and one of the factors is age. So that's one of the categorizations that puts people at risk and increases the likelihood that they're brought to us. The other thing is a lot of these elderly people are on blood thinners. That also increases the risk of injury. So things of that nature doesn't force, but encourages the EMT and the pre-hospital providers to bring them to us. The
blood thinners increase the risk of bleeding, obviously, but do they help cause or increase the odds of somebody falling?
For people who fall from either tripping or falling, they don't necessarily cause it, but they do put people at risk for more severe injuries. People can have intracranial hemorrhages or brain bleeds from the blood thinners. They can also bleed internally much easier just because they're at higher risk because their blood is thin from those medications.
Doctor, tell me about your research into postural control. What does that mean?
Yeah, so well, people who have impaired balance obviously are at a higher risk of falling. So one of the things that I study, as well as other researchers in our department, we have kind of a nice community of researchers directing their attention towards this problem. And we all kind of look at the multifactorial nature of balance control. And I'm specifically interested in how the arms respond to perturbation or when somebody's thrown off balance. And the reason why that's important is because it's kind of the last line of defense. So, somebody's already going to fall, and, the arms are the last thing that can actually reduce the impact at the head or the hip. So reduce a brain injury or reduce a fractured hip. It's also the first line of defense. So if you're kind of off balance, you can grab an object quickly. And we're finding that people who have had a fall may have an impairment in that response, the speed of it as well as the accuracy of their grasping.
Does the response change as we age? I'm sure it does, but is there, what does that graph look like? Is there an age where all of a sudden it gets worse, or is it gradual?
In terms of the arm response, there hasn't actually been a lot of research directed at that problem, so we don't know the trajectory right now. In my own studies, I've looked at different cohorts, so I haven't looked at followed a curve, but there's definitely an aging decline in the speed of the response as well as the accuracy in the response, and it gets worse in people who have had a fall.
Let me remind our viewers, if you have a question about falls and their prevention and treatment, give us a call. We'll have the number up on the screen. You can also tweet your questions. The Twitter address is @MPT News. We'll get to the phones, but let's do a word on prevention. What should people know about preventing these kinds of injuries?
I think to some degree it's awareness, it's knowing where you are, it's taking some things into account, if you go someplace new that you're not so familiar with, having people there with you. All those things can try to help you prevent falling, especially in places that you're unfamiliar with.
How about around the house? I mean, just in terms of not leaving loose stuff on the stairs and basics like that.
Yeah, those are some of the obvious things. So if you know that you have an instability problem, that's one thing that you can easily take care of. Take up the throw rugs, decrease the clutter. The other thing that I think is important that people need to recognize is that the bathroom is a particularly hazardous location, and most of that, obviously there's the slippery floors, but there's a lot of hard surfaces in a confined space. Right. Yeah. So installing grab bars in the shower or bath and by the toilet can be a huge help.
Let's go to the phones. Baltimore County, this is Gary. Gary, thank you for the call. Go ahead.
Yes, I agree with everything you say. My parents are elderly, and what I've assisted them with is in improving their grip. And right now they are in their 80s and they got a grip. Well, you wouldn't want to shake hands with them. And what I've done is I've taken out the thought and put in the reflex. So whenever they're in a situation where they're going up or down the stairs, doesn't matter what's on the stairs. If they sense an imbalance, they're going to grip, and if they can grip, they can save their lives. So I think it's all about strengthening their arms and strengthening their grip.
Gary, thank you very much.
Mm-hmm. Yeah, I think that's great. It's wonderful. I think and not only strengthening, but doing it quickly. And I think being in those situations where you have to respond quickly is great. Yeah.
Do the number of medications that people take as they get older cumulatively affect the body in any way? I mean, is that part of maybe slowing reflexes down a little bit?
Well, it's definitely part of increasing the risk for falls. Polypharmacy is a high risk factor for elderly people having complications, and when you mix medications, not purposely, but depending on the time of day and everything else they take into account, it definitely affects their stability and can potentially increase their fall risk.
We're also heading into a time of year where might have a little snow, might have a little bit of ice, certainly get some rain, and that's something else for people to take into account.
I think it's all really about self-awareness and knowing, taking precautions. We all like to think that we can keep doing things as we did when we were younger, but the reality is that as you get older, as we talked about, the reflexes aren't as quick as they were, and even a little patch of ice, a little leaf on a wet road, becomes very hazardous.
What's the long-term prognosis for somebody who's had one of these injuries, and maybe talk a little about the range of injuries that you see?
It really depends on the range of injuries. You know, we have some people who fall and they'll have something as simple as a broken wrist. And the term simple as a broken wrist is, I realize, on the spectrum of things. But, you know, some people come in with catastrophic brain injuries. Some people come in with spine injuries and rib fractures and pelvic injuries. And as I said before, rib fractures in the elderly are really a significant injury because their mortality increases as the rib fractures increase. So there's a wide range. Some patients, you know, have minimal injuries and are okay with them, and some of them have catastrophic injuries.
Let's go back to the phones. Arlington, Virginia. This is Phil. Phil, thanks for the call. Go ahead.
Thank you. My concern is how do you gauge when a person is living in your home like my mother was at 90, 92, 93, 94, 95, when it is time for her to be taken care of by somebody else, because she took a fall and broke a hip and unfortunately lost control of her situation.
Thanks very much for the call. How do you know? There's no test.
Yeah, I think it's a very difficult situation. We deal with that every day. Everybody wants to be independent. You know, people, as they get older, some people realize that they're losing their independence, and they don't want to give that up. And it takes a lot of conversations. It takes a lot of family involvement and social workers and physical therapists to really assess the situation and try to determine what is best for each individual person. But it is very challenging.
Mm-hmm. Yeah.
Dr. Westlake, back to your research. I'm curious what happens, you know, if I step on the proverbial banana peel and I'm starting to fall. What happens? What does the body do? How much is conscious versus subconscious?
Yeah, so that's a good question. That's an area of research that we're starting to focus on a lot more, and that's the influence of cognitive control. And I think we initially used to think that fall responses were you know, reflexive or subconscious. But we're finding more and more that they do require some cognitive control and specifically attentional control. So it may not be that somebody is having cognitive deficits that are obvious, but they may have trouble you know, dividing their attention or doing two things at once or shifting quickly from one thing to another. And that places them at a higher risk of falling. So we're starting to understand a little bit more about how that influences some of these quick responses.
Let's go back to the phones to Allegheny County. This is Lisa. Lisa, thanks for calling. Go ahead.
Hi. My mother just recently broke her hip, and she's going through rehab and the whole 9 yards. But I'm thinking that something like supported Tai Chi might be helpful in her balance. How do you feel about that?
Thank you very much.
Yeah, so there is some evidence to support that Tai Chi helps. It's a slower type of balance control, and so it will improve balance, and there's evidence to support that. But whether or not it reduces the risk of falls is another question, and I think the jury's still out as to whether that's effective or not. As I said, it's really the higher level quick responses that need to be developed. So while Tai Chi might improve, that's the slower balance responses, it may not improve the fast responses that are necessary.
What's the emotional side of this for somebody that you've treated for a fall? I mean, it could be in a way. I mean, hopefully, even if there's no physical deficit going forward, it's a bit of an awakening and must be a difficult time.
Yeah, I think it's to some degree it makes people wake up and realize that they may not have the same capabilities that they thought they were when they were younger. It's also a big for the family as well. You know, it's just siblings who now may have to take care of these people. So it's a big eye opener to these people, and to some degree, it sort of pushes them to a new part of their life that they weren't maybe not planning on.
If there was one thing that you take away from all the people that you've seen, you've treated, one piece of advice. Can you boil it down to that?
That's difficult. I would have to say, you just family involvement, having a support system, and being very realistic on what your capabilities are. And despite potentially losing your independence, being safe is better than being independent.
Prince George's County, this is Jim. Jim, thank you for calling. Go ahead.
Yeah, I'm wondering if they're so big on preventing bathroom and fall injuries, like my county a number of years ago required all home builders to put in to put in fire sprinklers. Why don't they do the similar kind of thing for having grab bars and safety items in houses and apartments?
Interesting question. Thank you very much. So certainly, if you were building a senior citizen complex, you would have some grab bars in various places, and the bathroom would be one.
Right. Yeah, it's unfortunate. The CDC recently came out with a study showing that hospital admissions for falls, the people who were admitted, there was a low percentage of people who had fallen in the bathroom who had grab bars installed in the bathroom. So I think that making it a standard approach to senior living facilities might be a good option.
Yeah, I think to some degree it's being understanding that having your limitations and needing these things, and to some degree it affects people's sort of feeling of independence, and it's, as we talked about before, it's a big emotional step in people's lives to realize that they need help at that age sometimes.
Call from Anne Arundel County. This is Dave. Dave, thank you for calling. Go ahead.
Yeah, so I'm kind of wobbly when I'm walking, and my doctor at the VA says he blamed it on my shoes. So I bought like 3 different kinds of shoes. I'm still wobbly. Is that a cause of being wobbly?
Dave will get you an answer. Best of luck there.
Yeah, so footwear definitely is a concern, and that's one of the first practical things that you can do is if you're finding yourself to be a little off balance, is make sure that you're wearing stable footwear. But if that hasn't changed the problem, then it might be worthwhile to have an assessment done by maybe a physical therapist who can actually run through a complete assessment for any of your fall risk factors, and maybe individually identify them so that we can create a rehabilitation program that's directly targeted toward that.
In just a few seconds, is that the sort of thing that the average primary care doctor is maybe sensitized to? And if they were to order that, what do you ask for?
Physical therapy assessment for balance, and it can be as general as that, because we really have to go through a complete assessment and understand all of the fall risk factors and rule them in or out before we design a program.
Dr. Westlake, Dr. Menaker, thank you very much for your time.
Thank you.
Thank you.
We appreciate it. Coming up tonight, what you need to know about possible new changes to the health insurance market. We'll be right back.
Got an unused vehicle going nowhere? Donate it to the one place that can take you any place. Visit mpt.org/vehicles and support the programs you love on MPT.
The MPT app puts our programs right at your fingertips, so you can choose when to watch, what to watch, wherever you want to watch it. Download it now.
What happens in Japan and Asia matters to me. And with NHK World's newsroom in Tokyo, I get the news live from Japan right at the start of my day.
New ideas come out of Asia all the time. NHK Newsline reports on business, technology, and world events from Tokyo to Bangkok.
Once in the morning gives me a heads up on the competition.
Every hour on the hour, the news I want from Asia.
Watch NHK World now on Comcast Channel 268 and Verizon Channel 480.
A hearing held today could lead to additional increases in insurance premiums under the Affordable Care Act. Joining us now is Jonathan Weiner, professor of health policy and management at the Johns Hopkins Bloomberg School of Public Health. Dr. Weiner, thanks for being with us.
My pleasure, Jeff.
So let's start with what the Trump administration did in not making certain payments. What were those payments?
Well, it's very complicated. President Trump did several things. The one that you're referring to is called the CSR, Cost Sharing Reduction. So normally when you get a health insurance plan, there's amount out of pocket. In the case of the ACA Obamacare plans, it's fairly high. It can be up to $6,000, $7,000, $8,000. But in this case, President Trump, or actually Obamacare, paid certain money to the health plans to ensure that low-income individuals in the marketplace plans actually did not get impacted by this cost sharing. So to say again, rather than having to pay out of pocket, the lower income individuals were covered by the health insurance plans.
Was there a legal question about those payments?
There was. President Obama had a hard time getting things through Congress, so he did use a loophole. Some people said it was illegal. A couple judges said it was legal. A couple judges said it was not, but it's been in place for a while, and President Trump actually did have a small grounds to question it.
Now, if nothing changes, and something may change, which we can get into, but if nothing changes, the reason the Maryland Insurance Administration held a hearing today is that the two insurers that are left under the individual plans in the insurance marketplace, the exchange, want their premiums increased to make up for this potential lack of funding. They're already getting gigantic, particularly Care First, a 50% increase. This would be on top of that.
One of their plans did have a 50% increase. Another one, I believe it was 30, 35, which is very high. And that was in place before this. Many say that they actually anticipated this issue. People did predict it. On the other hand, they are giving them the opportunity to raise their rates more. We'll see what happens. It's very ironic, though. Those people that are in the lower income part of the marketplace plan, the ones that are supposed to be helped by this cost sharing, they actually will still have full cost sharing coverage. But what will happen, in other words, the rates will go up, but then again, they will get help. They will get subsidized through various Obamacare coverage. So it's quite ironic. However, those people who are higher income will have to pay the full freight.
And those people have been seeing increases year after year after year. Do they get a break anywhere?
It's clearly the Achilles heel, and what's happening, some say it's becoming sort of a death spiral, that only sick people want to join these plans because you have to pay. It's very good coverage,
well, that was the
but you have to pay a lot of money.
The idea of the mandate, the controversial mandate, was to force everybody, including healthy people, to buy insurance.
It's all very ironic. By the way, the mandate is still in place. Various Republicans have suggested that they'll get rid of it. They haven't yet. And I've heard that the IRS is going to make people pay, a certain amount, the penalty, if they don't get a health insurance plan.
The president may have said something about not enforcing the mandate, but it sounds like the IRS
didn't read the memo.
Is enforcing it. The other thing to mention here is that this does not impact the majority of our viewers who get insurance either through another federal program, Medicare, Medicaid, or through an employer-sponsored plan.
We need to take a deep breath. So first of all, it doesn't impact 85, 90% of Marylanders, although those that it does impact are important.
Is it terrible news for 10 or 15%?
Yes, exactly. So those on Medicare, no impact for the elderly. Those who get health insurance through large group employers, no impact. Those who get health insurance, either Obamacare or the old Medicaid program, they're not impacted either. So you definitely should go on November 1st, if you think you're eligible, to the health care exchange, Maryland Health Connection. And if you have lowest income, you go into Medicaid, none of what we're talking about will impact you. If you're above a certain threshold, if you are in the lower part of that threshold, by the way, below a certain threshold, you go to Medicaid. Above a certain threshold, you go to private health insurance plans, part of the exchange, the marketplace. Now, the people below a certain amount of money, about $50,000 for a family of four, $30,000 for a single person, do get some subsidy. And many of them will not feel the full or any of this extra increase that's being talked about today with the Maryland Health Insurance Commissioner. However, those that choose to go to the exchange that are above a certain threshold will pay it all.
So the deal pending in the Senate that would reverse Trump's decision to withhold that funding would, if this goes through, and all the Democrats are backing it, and a handful of Republicans, enough to pass it if it comes up for a vote, would include a provision to let the states agree to have insurance plans, skinnier plans that would cover less. Is that a good idea?
No, it isn't. I think that there are some things that need to be changed. That's not one of them. I think, ironically, President Trump wanted to get people's attention. He did. I don't know that he firmly believes this is the right thing to do. But I think that the Democrats and some Republicans are actually sitting at the bargaining table, which is always a good thing. So there's still, stay tuned. Things may change. One thing that's important for your viewers, that people need health insurance. And Obamacare definitely helps people. It's helped 20 million million people across the country. And still, most Marylanders will not be impacted by all of this mess. Unfortunately, there will be some people that will be impacted, so it's not a good thing.
It's also open enrollment season for all those people who get their insurance through an employer. I don't know how closely you follow it, but what's happening in the broader healthcare universe in terms of costs, in terms of the premium increases, the deductibles, and so forth, that the average person...
They're rising. They're not as crazy as what's happening in the exchange, in part because of all the sabotage that's going on. I mean, if we just sat down and tried to improve the exchange and figure out, and I keep reminding people, you know, on the show and other places, that this is basically a plan developed by the moderate Republicans. So this is not a, you know, way out of left field kind.
Still blaming Romney for this?
It's basically
this was Romney
exactly. It's Romney
right?
care. This is a role, and in fact, Bernie Sanders doesn't like it because there's too many corporations involved. So I'm not sure what the moderate Republicans are looking for. We need to make this work. Right now, it's a mess. It is not working. But we have to stay the course, and anyone viewing should get health insurance and should go to Maryland Health Connection on November 1. By the way, they only have you know, the 2 months, and after that, they won't be eligible. 70, 80, 90% of the people that go on to that site going into Medicaid or this exchange will actually get very substantial subsidies, even with what's going on today.
Jonathan Weiner, the Bloomberg Hopkins School of Public Health. Dr. Weiner, thanks for your time.
Thanks for having me. Bye.
Thursday at 7:30 on Your Money and Business, maximizing social media, how to build your brand or business. Also, a new online tool is simplifying complex calculations. Join us for that. Your Money and Business, Thursday at 7:30. Remember to follow us on Twitter at MPT News. Look for videos of our recent programs. They are online at video.mpt.tv. That's video.mpt.tv. For all of us at MPT, I'm Jeff Salkin. Thanks for watching and have a good night.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.
This program was made by MPT to serve all of our diverse communities.